By the way, this syndrome is also called Texneck. Headaches can also occur, including dizziness. First of all, posture causes muscle overstrain because when we feel pain, it indicates an imbalance. You might wonder, what does the neck have to do with the chest muscle? Hello friends! As always, we meet here on our channel Healthy Hands. Here we talk about the health of the back and joints. With the help of exercises, we restore the health of our back and joints. And today, we will talk about the neck. What kinds of syndromes are there? What exactly gets stuck when we wake up in the morning and can't move our neck? Why can dizziness occur? And specifically, which particular muscles and which important arteries influence this condition? Why can our neck be curved forward like this? And what affects this? Which structures? And what kind of posture? So don't switch away, because with the help of exercises, we will learn how to get rid of certain pains as well as posture defects. Subscribe and let's get started. Friends, let's talk about the neck. There is one major syndrome that causes many different symptoms and different pains in the cervical spine region. Now, we will break it down. This syndrome is called the forward tilt syndrome or the upper forward tilt syndrome. This is a syndrome in which our head falls forward and accordingly, the tension in the neck muscles increases. By the way, this syndrome is also called Texneck or the reader's neck. Which muscles commonly suffer in this case? First, the area between the shoulder blades suffers. Quite pain may appear there. Second, pain may also appear in the area of our 7th cervical vertebra. Why? Because the trapezius muscles are constantly overstrained. Next, pain may appear directly in the neck extensors. Because when the head drops down, the neck muscles immediately try to hold it up, and accordingly, they simply can't do it because they are significantly overstrained. And the short extensors of our head become deeply involved, which then go into a state of hypertonus, become more swollen and inflamed, and can potentially affect the vertebral artery, thereby irritating it considerably. As a result, its lumen can narrow. Thus, we frequently headaches appear, such as dizziness. Next, we have, against this background, the muscle that lifts the scapula contracts because the shoulder muscles involved in inhalation, which are located above, are constantly tense. As a result, the muscle that lifts the scapula can experience pain. There may also be pain in the strap muscles that run along our spine. Accordingly, when turning the head to the left or right, pain may occur. All of this is one syndrome, which is called the forward head posture syndrome. And today, we will go over several exercises that, first of all, will help you return your head to its physiologically correct position, open up your shoulders, and only after that, forget about the pain. Because first of all, posture causes overstrain in the muscles, which in turn puts pressure on nerve endings as well as on pain receptors located in our muscles. Together, we will achieve good posture, get rid of pain, and be healthy once and for all. Let's get started. So friends, first of all, we need to work on the chest muscle. You might wonder, what does the neck have to do with the chest muscle? In order to open up our shoulder blades and allow our shoulders to stay in this position, we need to stretch the chest muscle so it releases our shoulders and lets them return to their correct natural position. That's why we will be stretching the pectoralis minor muscle. How do we do this? We find a doorway, place our arm like this in the doorway, and simply twist our body in the opposite direction so that, as you can see, the green muscle, the pectoralis minor muscle, can stretch. Accordingly, do 15 repetitions on one arm and 15 on the other. You can accompany all of this with an exhale as you stretch the muscle. Why do we need this? We need this, first of all, so that we can proceed. Our overall blood pressure, arterial pressure, does not increase. Secondly, with the help of exhaling, our muscles can deliver several times more potential than without exhaling. This means that the muscle can stretch more strongly. Our goal is to stretch the chest muscle so that the area between the shoulder blades can continue to be worked on and become stronger. Because if our chest muscle is holding us, no matter how much we strengthen the area between the shoulder blades, the chest muscle will pull the shoulders forward and accordingly will not allow us to open up the chest. And this is exactly the foundation of good posture. 15 to 20 repetitions for each arm. And now, exercise number 2. Our task is to strengthen the strap muscles. They are located right here, and their function is to pull the head back. Let me remind you, if they are too weak, the short extensors become engaged, and in turn, they become hypertrophied and can affect the vertebral artery, which worsens the blood supply directly to the back part of our head. That's why the inherent strength and overall quality of the strap muscle are so incredibly important. This crucial aspect will determine precisely how much we can effectively reduce the tension directly in the occipital area. How do we perform it? Let me show you. From this starting position on the exhale, move your head back. Note, not tilting it, but moving it back, and then return to the neutral starting position. Again, move back, then return to the starting position. I want to emphasize that you don't need to push your chin forward. You just need to return to the neutral position. Move back, then return to the neutral position. The chin doesn't move up or down, and it isn't pressed in. Do 15 to 20 or even up to 30 repetitions like this. Make sure that you don't experience increased dizziness. Make sure you don't develop a headache while doing this exercise. It's important to exhale. With every exertion, the exertion or effort happens when you move your head back. Accordingly, make the movement much easier by exhaling slowly as you gently move your head back. And now, the third exercise, friends. Stabilize the area between your shoulder blades and a bit below it. Also, engage your latissimus dorsi muscle. The goal of all these muscles is to lower your shoulders so that the inspiratory muscles, the upper part, are not overstrained. And accordingly, they don't bother us or cause pain, because right now when we feel pain, it indicates an imbalance. It means that the muscles that lift our shoulders up are too strong, they're overstrained. And the muscles that lower them, on the contrary, are too weak. Our task is to make the muscles that lower them stronger. Find a doorway, hold on to the doorway with your hands, and start the exercise. Starting position, hold on to the doorway. It's best to wear sneakers so your feet don't slip because we're standing at an angle. As you exhale, pull in, bring your shoulder blades together using your elbows and shoulder blades. Try to reach downward, down. What does this mean? It means that your shoulders shouldn't rise upward. Keep your head in a neutral position. You should feel tension only in the area between your shoulder blades and maybe a little lower. Do this exercise. 15 to 20 repetitions. If this is too difficult for you to manage, you can simply decrease the angle of your body and it will become significantly easier to perform. If, on the contrary, you want to make it harder, simply increase the angle of your body. With each lift, we exhale. Again, this is to prevent our blood pressure from rising and to make the exercise easier, and to increase the working potential of the specific muscles we're targeting. Friends, of course, you might have a perfectly reasonable question. Why are there so few exercises specifically for the neck? 95% of neck pain is caused by poor posture of the upper part of our body. For example, this kind of posture. That's why with these exercises, we return our posture to its physiologically correct position, and in doing so, we relieve the tension from those trigger points that were causing you pain. So take this set of exercises for yourself. If you enjoyed this and found it helpful, please subscribe to the channel, give it a like, let me know in the comments if it was difficult, and stay healthy.